Hi, Bailey here. Here we are. Thanks for coming to Providence Eye and Laser Specialists. I'm so excited for you. I guess you've already met some of the staff. They're great. Don't hesitate to ask them any of your questions during your visit today. They all have extensive experience in the LASIK industry. You'll meet our doctors in a bit. They're the best, seriously. But first, let's meet Dr. Mosiani. He's Providence Eye's founder and vision correction surgeon. He built this practice himself with a very specific vision in mind. His list of credentials, impressive. Do you know that he's not just an ophthalmologist? He's a cornea specialist. You probably already know that LASIK is surgery on your cornea, which means he's the perfect person to perform your LASIK procedure. Oh, you want to meet Dr. Mosiani now? Great. Doctor, you're on.
To put the patient first and always think of what is best for them and what is going to be ultimately the most satisfying to them. That's by far the most important thing you can do. That then leads to a relationship that we all know will turn out very well.
Dr. Mosiani's not the only doctor in the house. We've also got Dr. Vanessa Mills, and she's without a doubt one of the best optometrists in the region. She rocks. No, really, the patients just love her. I could go on and on about her, but, well, let's just meet her.
I love coming in every day. It's just such a privilege that I get to take care of people's eyes and learn about, the lives of people, their vacations, get to see their family, their friends. It's such an honor that people do refer their patients to me.
We've also got Dr. April Medeiros on our team. What do our patients think about her? She's a great listener. Dr. Medeiros is a very calm, caring person who enjoys interacting with her patients. She wants to know her patients, who they are and what they do. And to her, there are no bad questions. But don't just listen to me, listen to her. Take it away, Dr. Medeiros.
My philosophy has always been you just really need to get to know your patient and understand what it is they want. And sometimes they're not sure what they want. So you really have to talk to them about what they do for a living, what they're doing day to day, what they're using their eyes for, because there's a lot of different solutions for how we can correct their vision based on what they're doing. So if you get to know the patient, you can make recommendations to guide them. We're really going to take the time to do a thorough evaluation of your eyes to determine if you're a candidate. And if you're not a candidate, we're going to let you know that we don't want to take any kind of risk with your eyes, and we wouldn't recommend that you do either.
See what I mean? The doctors here at Providence Eye are awesome. They really treat you like you're a part of the family here, and I'm not just saying that. But the great thing about this family is that they have a collective vision that guides the philosophy and purpose of Providence Eye. Check it out.
We create a philosophy here and look for people from the very beginning. When we hire someone, we look for people who have the same philosophy and then build that culture within the group. Pay attention to every little detail because everything counts.
Listening to the patient and making sure that we take the time to understand what it is that they're hoping for so that we can work together, all of us, to reach that end goal for them.
Dr. Mills and I have been working together for over a decade. That partnership that we have has really built the philosophy of this entire practice.
With every patient, I don't feel rushed going through the practice. I don't feel rushed going through each exam with every patient. I get to listen to them, learn, what's going on with their eyes. The patient is the priority in the practice.
So who's a good candidate for LASIK, you ask? There's no way that you yourself could tell if you're a good candidate. After all, that's why you're here to see Dr. Mosiani, right? Some of the things that Dr. Mosiani is going to look at to determine if you are a good candidate are your vision, the health of your eye, and every aspect of your cornea. Okay, so now you know a little about the doctors and how they determine if you're a good candidate. They love what they do, but want to know what makes it possible for them to do what they do? The technology. Here, it's the latest and best available. I mean, state of the art. Check it out. LASIK surgery is a delicate process, and Dr. Mosiani knows that. He doesn't leave anything to chance when it comes to technology. Simply put, he invested in the best equipment available. It all starts with what's called a pentacam corneal mapping system. With it, Dr. Mosiani will be able to look at a high-definition scan of your cornea. This is what the scan looks like. You see, corneas are like fingerprints. Everybody's is different. This scan tells Dr. Mosiani everything about your cornea: thickness, structural integrity, and strength. All of this information is critical in determining if you are a good candidate for LASIK. The lasers that Dr. Mosiani has invested in are like no other. In 2003, Dr. Mosiani was the first cornea specialist to perform all laser LASIK in the Charlotte region.
13 years ago, we switched from blade, or what we call technically keratome LASIK, to all laser LASIK, which we called intra-LASIK back then. And then in 2012, we implemented OptiLASIK, which really was the next generation of the all laser process.
Recently, Dr. Mosiani introduced OptiLASIK when he upgraded his technology to the WaveLight FS200 and the WaveLight EX500 to provide you with the most precise, predictable, comfortable, and fastest vision correction possible. LASIK is a two-step procedure. The FS200 laser is used to precisely create a corneal flap. It only takes 15 to 20 seconds per eye. The complementing EX500 laser is then used to reshape your cornea. This is the step that actually corrects your vision and takes 3 to 15 seconds per eye, depending on the amount of correction. I've explained it pretty simply here, but let me tell you, it takes an expert with extensive experience to perform surgery with this complex technology. Does it work, you ask? You bet. But don't just take it from me. Let's hear from some folks whose lives have been changed thanks to LASIK at Providence Eye.
I had been in contacts for about 20 years, and my eyes had had enough.
I've worn contacts for like 42 years.
I have worn contacts since I was 14 or 15 years old.
Dr. Mosiani and his entire team here have a remarkable ability to make each patient, I think, feel like they're their most important patient. The job that I have is kind of erratic hours. So sometimes we're up for maybe 36 hours straight with little hour or two breaks in between operative cases. And you can lay down with contacts in, but if you fall asleep, it really isn't worthwhile taking them out because you're going to get up within an hour and your eyes get kind of dry and scratchy and you put eye drops in. And now that I've had refractive surgery, that's not a problem at all. I can take a 20-minute nap at 2 a.m. and then get up and at least my eyes are fine. The rest of my body is tired, but my eyes are fine. Since I had my surgery, I referred my daughter, who was also what we call a high myope. She had a large refractive error, but so was I, and I did well, and I gladly referred her, and she did really well. But once I had the refractive surgery, then, not that I'm a big camper now, but I wanted to climb Mount Kilimanjaro in Africa, which is like 19,000 feet, and you have to be on the mountain for 8 days. And I did that 3 months ago, and I never would have done that with glasses or contacts. I mean, never, ever.
Well, I play roller derby for the Charlotte Roller Girls, and I was not aware that when you have LASIK eye surgery, you cannot play a contact sport for several months. And he molded the procedure to fit my lifestyle, and he gave me a different option to where I only had to be off my skates for 2 weeks, and it was perfect, and I really appreciated it.
One of my friends was complaining about her contact, and I was like, why haven't you had surgery? And she was scared of it, but I said, this is the best decision I have ever made. Dr. Mosiani was wonderful, and to this day, he is the only doctor who's ever called me at home.
I made appointments with 3 locations, and Dr. Mosiani was the last location that I came to. And so he explained to me their technology and showed me how it differed from the competition's technology.
Before I laid down, I looked at the clock, and it was very blurry, as it normally is. When I sat up, I looked over, and even though it was very hazy, I could still see the clock. I could see it very clearly. I look over, and Dr. Mosiani is sitting right there, and he has a grin on his face, ear to ear. I think he was more excited about it than I was.
See? Aren't you getting excited? If you want to read more testimonials about Dr. Mosiani, check out his Google reviews and his Facebook page. The internet is really honest when it comes to patient experiences.
It is a pride factor in the fact that it's a family-run and operated business, and I don't get the sense that it's, for lack of a better term, a chop shop where people are really trying to get volume of people in here. And I really got the sense of the people and their knowledge and the size of the team that it was a very tight process.
They wanted to find out about me as a person. What do I like to do? What are my hobbies? What's my profession? So they did want to know about me as a person and how this surgery would impact my life.
I chose Providence Eye because of the service that I got, and just really felt like I was treated as an individual, as a valued person, not as a number.
Ooh, I'm sorry. Your eyes are starting to dilate, aren't they? Here, let me turn down the brightness a bit. There, that better? You've probably heard a lot of things about LASIK, and you probably have questions, which is great. Dr. Mosiani will be happy to answer all of your questions. Most people tend to wonder about the same things. For instance, a lot of people think that they have to keep their eye perfectly still, or they're afraid they're going to blink and ruin the procedure. Not true. The Wavelight EX500 laser has the most sophisticated eye tracker. It uses 3 infrared cameras to track eye movement during the procedure at a rate of 1,000 frames per second. If your eye moves at all, the tracker senses it and adjusts the laser to compensate. If your eye moves too much, the laser stops temporarily. Also, you might wonder how you keep your eye open and not blink. Maybe you're afraid you're going to blink and affect the procedure. No worries. You don't have to keep your eye open by yourself. The team will place some numbing drops in your eyes. You actually won't have the urge to blink at all. Then, Dr. Mosiani will very gently place a small device that will keep your eye open for you. You may also wonder about how long your recovery time will be and when you can return to your normal activities. After you leave our office, you'll go home, you'll need someone to drive you, and take a long nap, probably around 4 hours. When you wake up, you'll feel very good. You will see a significant improvement in your vision at this point. By the next morning, your vision will have improved even more. You'll come back to our office for a quick 15-minute post-op exam with Dr. Mosiani and his team, and you can then resume most of your normal daily activities. You'll be asked to take a little extra care with your eyes for just a couple of weeks. No contact sports, be careful if you are playing with young children, and avoid rubbing your eyes. And no need to memorize any of these directions. You'll receive detailed written post-op instructions. Most patients also have questions about the P word, price.
Our philosophy is to provide the best outcome, the best overall experience, and the best technology to the patient, and we always put the patient first. Our pricing philosophy is kind of associated with that, so we definitely don't believe in discounting LASIK because that almost always forces someone to cut corners, which is against our philosophy completely. We want to make the procedure affordable, and we have financing available to help do that, but ultimately we want to provide the best experience and technology, and we're very confident that that combination of what we provide is not found anywhere else in our community.
Providence Eye is not afraid to talk about price one bit. They have a very simple and honest pricing structure. Unlike many other LASIK facilities, their pricing is not based on how bad your prescription is or if you have astigmatism. At the conclusion of your consultation, one of the great staff members will be happy to review the pricing with you. It's important, and they know it. These are just a few of the questions the doctors here can answer. I'm sure you have others that are specific to you, so feel free to ask the expert staff or doctors any of your questions. That's what they're here to do. You're in good hands here at Providence Eye. So here's the thing that really impressed me about Providence Eye. If you're not a good candidate for LASIK, Dr. Mosiani is going to let you know that. He will only recommend laser vision correction if you are expected to have an optimal outcome. If he has any leading indicators that you will not have a good result, he will explain it to you and answer all of your questions. Because the consultation process is so meticulous, it makes the actual surgery very predictable. 97% of patients are 20/20 or better. So what about the other 3%? Some people do need a minor tweaking to get them there, but that is all included, and Dr. Mosiani knows how to handle every detail. After all, he has done literally tens of thousands of vision correction surgeries. It's all about you at Providence Eye. They treat you like an individual, not a number. By now, you've experienced the first part of the consultation. Pretty soon, you'll go in to meet the doctors. Tell them I said hi. If you get a chance, check out the pictures of their families. Family is really important to them. Anyway, the doctors and the team will check your eyes and make sure everything's healthy. The retina, the cornea, the optic nerve, everything. Once he and the team look over everything, he'll talk to you about how you use your vision personally and professionally. He wants to make the best recommendation for both the short term and the long term. And trust me, he will listen to you and answer your questions. He's very approachable. So what can you expect if LASIK is right for you? On the day of your surgery, you'll be in our office for only an hour and 15 minutes, much shorter than today. You'll first check in with the front desk. They'll go over your forms and verify your information. Next, you'll be given a small dose of sedative to help you relax. One of the doctors will remeasure your vision to confirm the measurements taken during your consultation. Yes, they are that particular about everything. You'll then meet with one of the great staff members who will go over the post-operative instructions. These instructions are fairly simple, but very important. It's always good if someone else listens with you at the same time. Drops will be placed in your eyes, and the area around your lids and lashes will be cleaned. Dr. Moziani will then go over exactly what to expect in the OptiLASIK laser suite. The technician will assist you to the laser bed. That's one of the great things about the Providence Eye Laser Suite. It's all in one room, and you don't have to get up or switch beds. They have made it as easy and comfortable for you as possible. Numbing drops will then be placed in your eyes. From then on, the only thing you feel may be a little pressure. Using the Wavelight FS200 laser to create the flap and the Wavelight EX500 to reshape your cornea, the OptiLASIK process takes about 30 seconds per eye. From start to finish, you will be in the OptiLASIK laser suite about 10 minutes. I know, it's amazing. Well, I think you're just about ready to go back and meet the doctor. I hope you're a good candidate. See ya!